You did.
Yeah, they mute you automatically. Riley, these things ain't working. Still coming off way up.
What?
Still coming off your speaker.
Come here.
We've got some mics that are not muted. So if you guys want to start muting those mics, that'd be fantastic, please.
Mine's muted.
Whoever just said theirs is muted, it's not. All right, we're going to get going in about a minute or so. So just hang tight.
Hey, so on these Zoom meetings, when it says unmuted, and then I hit it and now it says mute, is that where I want it?
Thank
He
you.
wants to mute.
Yes, that's exactly where you want. When it says mute and you can see the little green thing moving in the microphone, that means you're unmuted. You want to have the slash through the microphone is how you're unmuted, or is how you're muted. Unmuted would be nothing over top of the little microphone in the corner. All right, guys. Michaela, are you on? Are you ready to go?
Yeah. Yep.
All right, so we're going to get started again. Just if everybody can mute their microphones, that would be very, very good throughout this. I did notice last week when I went back through and watched the webinar, is those folks that are on your phone, you really have to make sure that you're muted. Okay, so if you're on your phone, I know I see one that's not muted. There we go. So we're just about ready. Matt, can you hear me? Dr. Owens? Dr. Owens, are you on? He's calling me right now. Hang tight, guys. All right, guys, we're just having a little bit of trouble getting Dr. Owens on the line. And give him just a minute or two here, and then we'll get started. I've got a couple of slides as well. Just a heads up for those of you that are on the phone. I cannot stress it enough. If you could please make sure your mics are muted. And then also, if you don't want us to see you, you may want to take yourself off of video, unless you want us to see you eating supper and things like that. So if you are on video, you might want to take yourself off of that. All right. Dr. Owens, do we have you yet? Michaela, do I have you?
Yeah. Yep.
Can you maybe give Dr. Owens a call and see once?
Yeah.
He's calling me right now. No, he just didn't. So if you want to give him a call on his cell phone,
Okay.
I'm going to get started with my portion of this, and then we'll hopefully be able to transition right into him. If we could please mute your microphones. The last thing I want to do is start dropping people off because we can't hear. I've got a microphone that was not muted there, please. Thank you. We really have to be aware of that this evening, guys. Last week we had a couple times where we had folks that were getting in over top of the speakers, and we don't want to have that happen this week. Okay, so having a few technical difficulties. It wouldn't be Zoom without that. So
this is Dr. Owens. Am
okay.
I on?
Yes, Dr. Owens, I got you. I'm going to start real quick, and then I'm going to bring you in, okay? All right. Great to have you guys all on. I'm making sure I'm not muted. Can somebody jump on? Can you guys hear me?
Yeah.
I can hear you loud and clear, Kyle.
Okay, sounds good. Okay, here we go. So welcome to our second webinar. It's been kind of a crazy week out there. Dr. Owens is going to talk to that, and then we have a number of other speakers that are going to jump in and visit with us too. So welcome to the second webinar. Last week's webinars, as well as future webinars that we're going to be doing, are going to be available to listen to and to view probably the Monday after. So on Monday they'd be available to do that. Again, thanks to AHEC, Michaela Titus, and Sandra Durek for their continued efforts in making this webinar happen. This webinar is not intended for the media, so if there's anybody from the media that's on, please hang up now. Again, please mute your microphones. It's very, very important so we don't get that unwanted feedback. And then thanks a lot to our panelists who are going to be taking time to talk to us. Again, there are 2 hours available for this webinar. You can go onto your state EMS portal and sign up for those 2 hours. If you don't know what I'm talking about or have never done that, please email me at the email that's listed on this slide, or if you go into the chat portion of the webinar, I did list this email as well as my cell phone to send me a text. What I need from you is your name as it appears on your South Dakota EMR or your South Dakota EMT card. And I need those by 10:30, or actually by about 10 o'clock tonight, as the sign-up period is going to close at 10:30. So if you could send me your name, if you need me to clock you in, that would be great. I'm sure many of you have used this platform before. If you want to have your video on, that's totally fine. Just remember that we can see everything you're doing. So if you want to have your video on, great. If not, you go ahead and mute your video and then just be listening to the audio portion. You'll still be able to see the slides. To keep things orderly, we're going to wait until the end to ask any questions. We do have like 6 or 7 different presenters tonight, so we're going to be kind of busy. You may ask questions in the chat area. Is kind of where I'm going to prefer them tonight, I think, since we do have a large group of presenters. But if you have something that you want answered live, that's fine too. If you can ask them in the chat area, that was probably going to be the best spot to do that. Discussion panel, myself, I'm kind of moderating. Dr. Matt Owens again from Redfield Community Hospital. Sarah Jez is on the line from Brown County Communications. She's the Assistant Communications Director there. Keith Shurisky, Aberdeen Fire and Rescue Training Section Chief. We have Chuck from the Strategic National Stockpile with the South Dakota Department of Health. Dr. Tom Lazier from Verizon. Colonel Dan Kirkpatrick, disaster preparedness expert out of Ohio. And we also have Deb Arms, who is the Ohio Nurses Association president. So they're all gonna be kind of talking to you tonight and giving you some really good information. So I'm excited for it. Again, stay up to date, www.cdc.gov, covid.sd.gov, and then the Department of Health.sd.gov. Providers of Rural Health EMS is where you can find some very good information that is directly related to what we're doing as EMS providers. So with that, I'm going to turn over to Dr. Owens.
Thank you. First of all, I'm going to just zip through what we did last week and turn it over to the subject matter experts. As you can see, that's a picture of the coronavirus. Please note, it does not have wings, it does not have legs. Basically, I view this as a behavioral disease. As discussed last week, coronavirus, common virus in everything from cattle to cats and now to humans. Looks like the outbreak was probably due to bat origin. Basically, the routes of transmission, once again, you're going to hear me say this over and over again. It's basically coming in from the respiratory tract. I don't think the GI tract is playing a very big role at this place or at this time. Basically, for the take-homes for the EMTs on this conference, wear a mask, wash your hands, and keep your equipment clean. Can everybody see our screen?
Yep, we've got it up there now. We're good.
Okay, so spread. Primarily spread person to person through respiratory droplets. Think of the term hacking cough, less likely with sputum. Incubation period still not well defined. Estimates anywhere from 2 to 14 days after the exposure. Latency. This is very problematic. It's asymptomatic period development in the host. One of the questions that we will find at some point in time when we get rapid testing will be what percent of people who are shedding virus with no symptoms, and that will help us track and control this and get it back from mitigation back to containment. Alternative routes. Basically, this deals with fomites. There's been a lot of things on the internet and TV about they may last 4 days or 10 days, and some people think it can repeatedly stay on cardboard even longer. I'm here to tell you that the evidence is unclear. So once again, wash your hands. Close contact. That's defined within 6 feet of another individual. If you can stay 6 feet or further, the best way to prevent illness is to avoid exposure. But there's some issues with this. We call it social distancing. I prefer if we called it more.
We have somebody that's not muted. Please mute your microphones. Somebody who's watching TV, because I can still hear you. Thank you.
Okay, back to this best way to prevent illness is to avoid exposure. there is some downsides to this. So I think we need to, I can hear other people on, but anyway, we should probably call it, instead of social distancing, we should be calling it physical distancing.
Hey, Dr. Owens, I'm gonna jump in there real quick.
Okay.
I really need you guys to mute your microphones. This is not working. I'm still hearing it. If we find out, if we can see on the top of our screen, we're gonna cut you off. Please mute your microphone. Whoever's watching TV, please mute your microphone. It's still not muted.
It should be muted now.
There we got it. Okay.
Okay, so back to this distancing thing. So more than 6 feet away, you're pretty safe. Best way to prevent illness or avoid exposure. I am telling you now, whatever, 4 to 6 weeks into this, I can't remember the pre-COVID days very well. And no, I'm not on AreaSept. But anyway, so like when you look at your elderly population and nursing homes, you need to rethink this as not so much social distancing, but physical distancing, because what is happening now with our, especially our long-term care, because they've been in lockdown, we're starting to see more depression, we're going to start seeing more pneumonia, more of the issues like that. One of our local long-term care facilities here actually has got a workaround on this. They take a few folks 6 foot apart, masks on, and they drive around to family and friends, and they call it the Honk and Holler Project. I think it's great. And this is another example where the EMTs really can help themselves out. And this slide is not just for EMTs, this is for the message that we need to get it out. We need to spread the word. If you are sick, you need to call your physician or your non-physician provider. You stay at home until instructed as to what to do. And the bottom thing is, if you must go out in areas, use a face mask. I would say follow steps 1, 2, and 3 before you consider going out. So this is almost like a historical perspective slide. It was up to date just a few, 2, 3 weeks ago. You look at the top, it says face masks should be utilized with symptoms of COVID-19 disease. Right now, all healthcare providers in my facility are wearing a mask and a blast shield. There's some data out there now that says even wearing a cotton mask by everybody, whether you have symptoms or not, while out in public, may decrease the spread. As you see below, CDC does not currently recommend the use of face mask. I think that's probably 3-week-old news. No current antiviral treatment, that's still true. Hand sanitizer and washing your hands still works. And oxygen therapy with severe respiratory distress was considered current best practices. You may be hearing on the media, and it may be on the extent of this call, but there's a thing now being talked about called allowable hypoxia. And what I would say to EMTs in general, you worry about the allowable hypoxia to the physicians. If you have somebody that's hypoxic, give them oxygen until we further get more information. So next slide. These are all still true. They're kind of what our moms taught us. If you're sick, stay at home. If you're coughing, cover your mouth. If you cough into your hands or just in general, wash your hands. And if you've been exposed to COVID-19, you would be most best served if you contacted your healthcare provider. So once again, this is a historically correct slide, and I keep trying to bring this up because we all need to be Gumby. The data on this thing changes daily, if not twice a day. So 3 weeks ago, the CDC recommended that they postpone any events that have more than 50. Now that we're in a world where 10, no greater than 10, and all 6 foot apart. The next one is true, that we need to stay up to date on CDC. And I would add the South Dakota Department of Health has some really good information on their website for COVID. So as some of the folks may remember, I had graphs and a number of things showing how to change the inflection point depending on which behavior, when you go into lockdown, when you go into distancing. Once again, this is a behavioral disease. Those graphs actually are no longer even close to what the graphs look like this morning. in some of the graphs as far as how many people are going to have the disease, how many are going to die, are changing rapidly. So don't look from graphs from last week, they've changed. But there's one graph I think that makes sense. We all need to work on flattening the curve. So the idea behind this, we've heard it to death on TV, but just so everybody understands, if we can slow the spread in South Dakota, North Dakota, surrounding states, and we can draw that number of patients that are ill down so every day is maybe just a little more, but not a big jump, our health systems are much more prepared if we can keep it below surge. If we can keep the number of people sick below surge, we will decrease death. So basically, choose your behavior, choose the where we're going to be at on that curve. Once again, prevention, keep your hands clean as EMTs, and Mr. Kevghas will discuss this more in depth later in this webcast about what is the latest and greatest on personal protection. I'll take questions at the end of this webinar.
All right, Dr. Owens, are you finished?
Yep.
Okay, so now next up on the list, we do have our friends from Ohio who have jumped on and have some remarks for us. So Colonel Dan and Deb, if you guys want to take over, it's all yours. Dan Kirkpatrick, do we have you on the line? Dan, do we have you on the line? Dan Kirkpatrick?
Yeah.
All right, Dan, do you have any updates for us this week?
The big thing is to look at surge capability. Hopefully, like Dr. Owen said, you're not going to need it, but if you do, make sure you got plans. Our fireman from our local fire department was going to be on. He just sent me an email that he's out on a call. The big thing he wanted to talk about is how they're deconning their ambulances. And I may have mentioned this last week. I know I mentioned it to Dr. Owens. They went out and purchased low-cost sprayers, like paint sprayers, and they use a chemical. And the chemical, the disinfectant we got, we checked with the Air Force, and they are using a chemical called Calla, C-A-L-L-A, 1452. And I looked that up. It's a disinfectant that's used for disinfecting large areas. You spray it on. It was actually used when they were transporting Ebola patients several years ago. And according to the Air Force, it's fairly effective. I had asked General Marks to be on the call tonight, but I guess he got tied up too. The other thing I wanted to talk about, and I'm going to let Dr. Arnhem speak to this, is nursing shortages and masks. So Deb, you want to go ahead?
Thanks, Dan. What I can tell you that we see here in Ohio is that because of the elective surgeries being canceled, we have a lot of furloughs going on with nursing staff. So there clearly are available nurses. Now, the issue with the nurses being furloughed is when they're called back, they need to be cross-trained into surge areas when working with the COVID patients. Now, we haven't had really big surge here in Ohio, but that is an issue that you might think about considering when as you work with your surge plans. So for right now, because we haven't hit the surge like New York has, we haven't really had a problem with not having enough nursing personnel. What the state of Ohio has done is the governor's asked them to the hospitals to work in a regional focus, so that the state's been broken up into 8 different regions, and the hospitals have worked together to figure out how they're going to handle any surge that we may see. Now, the issue with that is that as you are developing your surge plans in South Dakota, you need to be aware, make sure that nursing staff understands what the surge plan is. We just had an incident in Ohio where some COVID-19 patients were discharged to a rehab facility. The nurses didn't understand that they were going to be getting these patients. They had no PPE. They had no fit training, fit testing for any PPE they would get. And so they were really running blind when they got these COVID patients. So that's something that you need to consider when you're planning for any kind of surge that you might have in South Dakota. The issue with PPE that we're experiencing in all the hospital is most hospitals are now rationing the PPE, and so most of the hospitals will provide those patients who are working with COVID-19 patients one N95 mask that's been fit tested, although I do understand that some hospitals aren't even fit testing anymore, which is also a problem because the N95 masks, as you know, are not reliable if they haven't been fit tested. So again, a lesson learned for South Dakota is make sure that your hospital staff or anyone else who's going to be using N95 masks or any other kind of respirator be fit tested. The issue is that because of the rationing of the masks, hospital staff has been told to utilize that mask for an 8 to 12 hour period. Those people who are not working with COVID-19 patients are now being required to wear a surgical mask. And for those that are triaging, most of those nursing staff are wearing surgical masks with shields. The other thing that's happened in Ohio is we have a research institute in Columbus called Dept, and they have developed a sterilization procedure for the N95 mask, and I believe the surgical mask, but for sure the N95 mask. So our hospitals are, at the end of the day, disposing these masks in a receptacle, and those then are taken to Dept where they're sterilized, and the masks then can be reused. They're sterilized and can be reused for up to 20 more times. This has been FDA approved. And so there might be an instance where you might be able to contact Dept and see about having masks. Actually, what they're doing is they're providing machines. I know they've provided machines to New York, and I'm not sure where else, but there may be an instance where you might be able to negotiate some kind of a re-sterilization if you do not have enough masks. We do know that the National Strategic Stockpile does not have any more masks available. So hospitals in the state have been left really to the governor's office, actually, has been trying to find distributors who can distribute some of these N95 masks throughout our hospital system. So that's an overview of what's going on in terms of PPE, and I'll be happy to take questions. I understand we're doing it at the end of the session.
Thank you very much, Dr. Adams. We appreciate your insight and the experiences that you guys are having in Ohio. So we appreciate you guys being on the call as well. I think next here we're going to move on to Dr. Lazier, if he's on. Dr. Lazier, would you like to have a time to speak?
Now can you hear me?
Gotcha, Dr. Lazier. Go ahead.
All right. All right, so my current participation is to talk a little bit about the fact that you're going to face a number of people who have pulmonary symptoms. And you have to remember that you're going to see not just folks that are infected with the virus, but you're going to see a lot more folks that aren't infected. We're running into a season now that is going to be our asthma season, and asthmatic patients who are infected with any virus have more difficulty. So you have to remember your basic, because we get so concerned about the virus, the SARS virus, that we sometimes forget our other role. And they will be more seriously affected, but in the transport of these patients and that sort of thing, it should be remembered that oxygen is your friend. This is being emphasized, and you don't have to maintain over 90% in some of these patients. Remember that if you hear a lot of wheezing, epinephrine is also your friend. That can also, it can be used in acute anaphylaxis, which we see a lot more of in the summertime, particularly in the venom season. It also is a very effective asthma medication, and I've not seen anything in the acute management where the patient is quite a bit wheezier, where if associated with the virus that it is contraindicated. It really is not in the literature yet, but I feel that it it is a medication that you can use in person with acute respiratory distress and a markedly diminished oxygen at the time that you see them. I do want to be sure to emphasize also that you should treat all of the patients with respiratory illnesses as if they're contagious and infected until proven otherwise. As you know, we don't have big capability for recognizing it quickly, and the symptoms do overlap. So I would address and approach our patients that have respiratory distress or respiratory illness like they all have COVID until proven otherwise. I think that's really all that I have to add is that part of our respiratory care. So thank you very much for letting me participate.
Thank you, Dr. Lazier. We appreciate you coming on and always willing to help out our group. We appreciate it. We appreciated you being involved in our refresher this year, and we appreciate you being on here tonight. Next up on the list, I'm going to move to Sarah Jez. Sarah is the Assistant Communications Director for the Brown County Communications Center, and she's got some information for you. Some of you maybe have heard this already, but this might be brand new to some of you. So Sarah, if you're on, take it away.
I'm here. Can you hear me?
Yes, ma'am. We
Hello?
got you.
Okay.
We got you.
All right. I guess I'm not sure what all you guys have heard, but I just wanted to pass on some information about the policy, I guess, that Brown County has come up with, you know, as far as handling the patients, as far as radio traffic and sharing the information. The way I understood it, that's what you guys were kind of looking for me.
Yes, yes.
We did come up with a policy. Yeah, we came up with a policy. The big thing that we need to share with our first responders and, you know, any surrounding counties that we might do a medical intercept or something with, something you might hear from us is a code, which I know most medics aren't used to using the 10 codes like law enforcement is, but this one's pretty straightforward and I think it'll be easy to remember. But you might hear the code 1050M. So the M stands for the 1050 in law enforcement 10 codes is a use caution, and the M just denotes medical problem. You might also hear just PPE required. Either one of those coming from any Brown County dispatch, that's just going to tell you that you need to use your full PPE all the time. The Department of Health has agreed to provide all the public answering points access to the names of the current patients. So we are able to enter that into our computer-aided dispatch system. I'm doing that every day. So my dispatchers do have current up-to-date information on that. So we just want you to be aware that you might be hearing something a little different from us. If there's any question about it, feel free to ask, does this mean, PPE required or something? My dispatchers have been told under absolutely no circumstances are they to use the words COVID or coronavirus or anything like that on the radio. But if you just ask, is PPE required? They're going to tell you yes. I don't know if you have any other questions. I can share my email address. You're more than welcome to get in touch with me at any time. I think that's all I've got.
Thank you very much, Sarah. Appreciate that. Are you going to be able to stay on and answer some questions at the end at all?
I can if you'd like, yeah.
Okay, if it's okay with you, that'd be great. We've just got a couple more speakers left.
No problem.
And then if you just maybe want to drop your email in the chat portion, and then
Yep, absolutely.
people would have that. That's great. Thank you very much for the update. Next up on the list, I have Keith Sharisky from the Aberdeen Fire Department. If Keith would like to get on there and talk with us, appreciate that.
Good evening, everybody.
Hello, Keith.
Fair amount of information, depending upon what you want from me. I will do my absolute best. A short story, CDC is not recommending any changes in PPE. I've been sending that out to most of you guys every morning as far as that is concerned. One of the things that they are talking about is obviously the cloth masks and things like that. Aberdeen Fire is adopting the procedure that on every patient contact, we will be in eye protection, N95, and nitrile gloves. When the lead medic or the lead EMT gets in there and does the risk assessment, they can then switch from an N95 to a surgical mask if the risk is deemed to be low. That way we can preserve our N95s. Questions were brought up, not questions, but a comment was brought up about reuse of N95s. There are several procedures that are posted out there that can be doing it. Depends on your geographical area. We are choosing to use the, I forgot the word I was going to use. Anyways, as far as reusing, we're going to be using a UV light, using the same process as the University of Nebraska is concerned. We have talked to Northern State, and they have an autoclave, and we're going to be testing the N95s in the autoclave and see if there is any degradation in material. They also have the UV light sterilization process there as well. So we are working through a process to where we can set up if we need to begin conserving our PPE. The Department of Health came out today and finally gave us an idea of what to expect for surges. The speaker from Ohio talked about surges and stuff like that. Department of Health is anticipating our neck of the woods to be surging at the beginning of June to the middle of June. The two hospital systems in town are working on a plan to handle the surge. Plans are being developed for both on-site and off-site, but the off-site we can't speak of yet because we're still developing those plans. The surge capacity for the predicted surge is 287. And that's for, let me just double check something here. That's just related to Brown County. That's not counting our border counties. Currently, we do show a bed deficit. And like I said, we're working through that. One of the things that we're also working through is trying to come up with an idea for our border counties on how many of the local hospitals may be sending their seriously ill patients to Aberdeen's. Also, in-house. When I say in-house, inside our stations, we, based on the IFF, IFC, and CDC, are doing an awful lot with social distancing, to the point where we're not even letting our staff be within 6 feet of each other. We are asking our staff to protect themselves when they go home so that we can keep them working. The prediction is still, or the plan is still, that we should have a 25% staff loss due to sickness at any given time. For all of us, we need to have a plan in the back of our head on how to handle that staffing shortage. When I talk about that staffing shortage, I'm also talking about nursing shortages as well. And both the hospital systems as well as the Brown County EOC are working through that right now. I do see you have a speaker that's going to talk a little bit about the national stockpile and South Dakota's role in there and what's going to be happening there. I don't want to step on his toes, but the Department of Health, Office of Rural Health, Office of EMS is putting together some kits to send out to the ambulance services. They are targeting the services that have committed to transport the COVID-19 patients. So our services throughout the state, don't think you're going to get a gazillion of them. You're only going to get a few of them. And you should have received an email from Lance Iverson describing or explaining what you're going to get as far as that is concerned. The numbers are increasing ever around us. Iowa right now, as of this evening, has overtaken Minnesota. Iowa is really blowing up right now. Minnesota seems to be keeping themselves in check. Wyoming is keeping themselves in check. North Dakota is keeping themselves in check. Montana, Nebraska, South Dakota, Iowa are increasing pretty rapidly right now. Hopefully you heard all the news about Smithfield Foods down there. Department of Health is tracking that and is working really closely on how to help contain that. The Department of Health is also working very hard with both hospital systems in that neck of the woods to keep on top as best as they can. The reason why I bring that up is that all of us around here have high concentration of employees. Using Aberdeen as an example, Coda beef and molded fiberglass operations, they all work relatively close and they all have a mixed cultural diversity. I bring that to your attention so that you can help educate your neck of the woods and those people there. I believe that's all I have for my update. And again, I'll hang on for any questions at the end of this.
All right, thanks a lot, Keith. Appreciate that. Now we're going to go to Chuck from the Department of Health. Is Chuck on? Do we have Chuck Kevghas from the Department of Health on, please? Chuck, are you on the call? If you're on the call, you're going to have to unmute if you want to talk. I think while we get this going, we can probably start. We can probably start taking a few questions while we figure out where Chuck is at. So if anybody has any questions for our presenters, feel free to put them in the chat area or go ahead and unmute and ask those questions and then mute again. Yep, go ahead. Go ahead, Patty.
This is Patty Woodscomb. I just am talking to the Brown County people.
when within our EOC, Brian Collins is our logistics person, and he asked me to, if you had in Brown County, you have some PPE requests, to get it to our office, and we'll start working a little more on that. If we have to go further and do the, the official report, have you do that part, we will, but we have some connections right now. So within Brown County, if you are needing supplies, let me know at the EM office.
Perfect, thank you. Patty, could you just put your phone number in the chat for those Brown County folks
Yes,
who may
I
be
will.
asking? I appreciate
Yes.
that, thank you. Any other questions, comments? Anybody have anything for our group? I maybe have one, I guess. Dr. Owens, if you're still on, could you maybe speak to something you spoke about last week, is the potential for med students to potentially be integrated into the EMS side of things? Do you have any more information regarding that?
Now, Kyle?
Yep, go ahead.
I was on the phone with Chuck. He's trying to get in. He's having troubles with access.
Okay.
And he'll have a slideshow. And by the way, referring back to you folks, he's actually for the state of South Dakota, pretty much in charge of all the PPE. So when they talked about these go packs that have PPE in them, this is the guy that's put those together and is coming up with the logistics of dissemination and delivery and that sort of thing. They should be coming out. If worst comes to worst, I can probably call him and just put him up by the mute button, but I do know he has the slideshow. Michaela, do you have his slides? Okay, with that said, I have a question to Dr. Arms. Do you have some sort of document or a transition plan on how to bring nurses, one, back into their regular place of work, but number two, bringing nurses, and I'm thinking other allied health professionals, into support a mission, let's say, for a smaller hospital, as far as what you plan to train them as far as PPE and that sort of thing. What just-in-time training have you folks come up with?
That's a great question. And unfortunately, one of the things that's very unique about Ohio is that we're the only state in the United States that does not license their hospitals. So every hospital is a proprietary organization unto themselves. So the responsibility for bringing those people, those nurses back into the organization or transferring them to other hospitals is just based on contracts between the hospitals themselves. Now, many of the hospitals affiliate with each other. And so I cannot answer that question. I can find out, but at this point in time, I do not know how they are, how the hospitals have planned for putting nurses in other hospitals in some of our surge, like for instance, we have established our convention center as the surge hospital, but how they're going to go about staffing that hospital has not been reported yet. So I don't have that information at this point, but it's a good question, and I can see if I can find the answer to that. I don't know is the answer.
All right. Well, we appreciate you taking.
Thank you very much. I'm continuing to try to get Chuck on, and we may just have to put a cell phone by the mic.
Dr. Owens, I think Michaela was going to call you and try to get his phone number. In the meantime, while we're going through that, does anybody have any other questions for our presenters so far? Well, you guys are a lot quieter this week than you were last week. Anybody have any comments about what you're doing in your community that seems to be working? Anybody out there? I guess I do have a question I'm going to ask to Sarah Jez. I know you mentioned you're doing that at Brown County, but do you know, are the other dispatch centers in the state, are they going to be handling the same type of 10 code on suspected COVID patients?
I don't know if all of them are, but I have heard from a couple of them say using something similar, either the 1050M or a 1078, which is just for your information. I think it was Watertown was using a 1078Q for quarantine. I haven't heard of any other different codes yet, but those are the two that I am aware of.
Okay, thank you very much.
You're welcome.
Kyle, Patty again.
Yeah.
As Sarah and I were talking about this last week, we also just want to make sure that, you know, if in the heat of the moment you forget what a 1050M is, which some of our rural people don't use those codes very often, that just when you're replying back to tell them you're leaving the station, just ask them, is PPE required? And they'll still continue to tell you that, just so you know that, you know, if you don't remember what 1050M is in the middle of your call, you'll know that you can always ask them, is PPE required?
Okay, thank you very much. I did see a comment come through on Spink County is also using 1050M. So for our friends down in Spink County, thanks a lot, Pat Grant, for letting us know that. I did get a question. Will someone be speaking more on the PPE kits the state has or is planning to send out? Yes, there is. We have one more speaker who are having trouble getting connected. So
Kyle,
hopefully we get him connected. Yes, go ahead.
he is
Michaela.
about to call in, and then I will share the slides. So.
Okay, so maybe we have one more. We have time for one more question. If somebody's got a question. I guess I'm going to just go on and throw one out there. I see that we have a group of people on from McPherson County. Dave Ackerman, are you on? Could you maybe tell us what McPherson County is doing as far as a 10 code? Are they using anything like that yet?
Are you able to hear me, Kyle?
Yep, I got you.
Right. So what I did is I actually forwarded the Brown County information onto our PSAP. Everybody in Edmonds, McPherson, Campbell, Walworth, Corson, Ziebach, Dewey, it's a pretty large area actually, is all part of the Mobridge dispatch or PSAP. So I did forward that information on to the captain over at the Mobridge PD.
Okay.
I have not heard back quite yet on that. I'm hoping that we can maybe get on the same page. Some of the things, you know, coming from the law enforcement side, you know, when we start talking about the 10 codes, we're pretty familiar with that. But when we start making up, I'm sorry, not necessarily making up things, but when we start talking about things that are common for law enforcement, if you will, M is you know, familiar with male, F is familiar with female. So 1050M for us is 1050 male. But look, I mean, if you get that message out, we'll all adapt, and that's just fine. But just something to keep in mind. But yeah, still working on it.
Okay. Thanks a lot, Dave.
Chuck is here.
All right, Chuck, you're up, man.
Okay, what am I looking at for slides?
You're on the first slide, and if you just want to say next, I will follow you.
Okay, keep in mind I'm doing this from memory because I don't have the slides in front of me right now. I'm at home. But go ahead, next slide, and describe what I'm looking at.
So it's what is PPE?
Okay, basically what is PPE? Next slide. And what am I looking at?
The requirements.
Okay, why don't you read them? Read requirements.
Okay. To ensure the greatest possible protection for employees in the workplace, The cooperative efforts in both employers and employees will help in establishing and maintaining safe and healthful work environments.
Next slide.
Okay, and this is employers' responsibilities.
Read that.
Performing a hazard assessment of the workable to identify and control physical and health hazards, identifying and providing appropriate PPE for employees, training employees in the use and care of the PPE, maintaining PPE, including replacing worn or damaged PPE, periodically reviewing, updating, and evaluating the effectiveness of the PPE program.
Okay, and again, that's just basically, bottom line is the employer is responsible for providing it, providing the training, and making sure there's compliance with it. Next slide.
So employers' responsibilities, again, it says properly wear PPE, attend training sessions on PPE, care for, clean, and maintain PPE, and inform a supervisor of the need to repair or replace PPE.
Okay, and that's pretty self-explanatory. Now, basically, once you've been trained and you provided the PPE, it's your responsibility to use it. And then, especially with dealing with coronavirus here, because of the fact that the consequences can be rather devastating. Next slide.
Chain of infection is required for a person to become infected, and then there's a diagram that shows.
Okay, yep, around. Here's the thing, the main point, we're going to go a little more deeper in the next slide after that, but if you can break one link of the chain, just one link, you can prevent infection from taking place, or illness, as we say. Even if infection takes place, if one of the parts of the chain is broken, at that point there, you don't get ill. And go to the next slide.
Okay, so the 4 requirements for illness: contact with pathogen, and then it says some solutions, isolation, PPE, temporarily stop breathing. 2, a route of transmission, gets in the body, PPE and distancing is a solution. 3, increased numbers to establish an infection, so disinfection, washing hands. And 4, host must be vulnerable. And this is biological factors, prior exposure, vaccinations.
Okay, what this slide here says, one of the 4 steps all 4 have to take place. So number 1, if you can avoid the infection totally, that's great, but you may not know that. But at the same time, if you, let's say, for example, that I get exposed to, let's say, influenza, all right? So first of all, there has to be enough of the virus to get in to establish infection. In the case like we use of anthrax, if we're looking at anthrax, usually have about 8,000 to 10,000 spores of anthrax have to get into the body in order to overcome the body's initial defenses. If 1 or 2 spores gets in, bottom line is your body would just beat the crap out of it, and at that point there, no infection takes place, you're not ill. But if about 8 to 10,000 spores of anthrax gets in, at that point there, it can establish an infection and overwhelm your body. So when we talk about disinfection, we're looking at not so much eliminating all of the bugs, but basically just cutting the numbers down so they're no longer harmful. So that's one of the most important steps. Number 2, vulnerability is basically if I get exposed to, let's say, somebody coughs in my face and I'm exposed to influenza and I've been vaccinated, even though I've been in exposure and the number of bugs that got in was high enough and a portal of entry was created to get in, I'm not going to get ill because of the fact that I'm not vulnerable. And so when you look at portals of entry, you sit there and you say, like in coronavirus, this is a very critical thing. Coronavirus does not go through the skin, so that's not a portal of entry. It's not going to get in through the ear canal. That's not a portal of entry. But it can get in through the nose or the eyes or the mouth. So those are the areas that I'm going to try to protect. And I'll tell you the truth, up until about 2 months ago, I didn't even know you could get a cold through the eyes. And I was trying to figure out how the heck does that happen biologically. And what it is if the virus gets in, let's say somebody coughs at you and the virus gets onto your eyeballs, it can go in through the tear ducts, which empty into the back of the throat. So it's like, oh my God. So there's your portal of entry, because as we all know from coronaviruses, the infection usually has to get into the back of the throat in order to establish itself as infection and work its way down through the rest of the respiratory tract. So that's why we're focusing right now on trying to protect the airway, and again, nose, mouth, and that's why they've included face shields for dealing with this particular strain of coronavirus. Where we don't talk about face shields when we're talking about, let's say, influenza. So each bug's different, each portal of entry is different. So what you want to do on this slide is focus on, if I can eliminate one of these things, I can eliminate myself from becoming ill. Next slide.
It's portals of entry, but I think you kind of talked about that, but it shows all the different portals.
Right. And again, it depends. If you look at the slide, you've got all these different portals, you know, and you know, like I said, for some different types of viruses have different types of portals of entry. Some can be, again, vaginal, some rectal, some nasal. Others can be transmitted by other ways, from mother's milk or things like that. But in this one here, I think we'll just stay on the respiratory tract and eyeballs. So always stay focused. I need to protect these things. Now, the other thing to remember about coronavirus is even though it's not likely, it can still be transmitted from what we call formites, or let's say objects, where you touch a doorknob or you touch something else, and then you turn around and bite your nails or pick your nose or somehow place that virus in enough quantity inside your nasal passages or mouth. So that's why they say don't touch your face. Well, if you touch your nose, it's not going to get into the nasal passage. If you touch your cheek, it's not going to. But if you rub your eyes, or if you pick your nose, or if you bite your nails, or all the above, at that point there, you've introduced the virus to where it needs to get to. So for each bug, you're going to have different types of portals of entry and ways to do that. That's where good hand washing comes in, and you all know these as medical professionals. So again, think about it. After you're an EMT, you're working on an ambulance, and your partner touches the doorknob or something like that, even if they're wearing gloves and they've touched the patient, they could leave some of the virus on there. So periodic cleaning of common touch points. And if you want to know what the funkiest thing in the world, it's your cell phone. Your cell phone gets a lot of touching and a lot of transmission. So periodically take an alcohol pad and just kind of wipe down your phone and try to, again, disinfect it by just trying to remove some of the pathogens. And so that's, again, while this is going on, I'd say once a day, try to clean your phone. And it doesn't have to be anything exotic, because most of the disinfection that will take place with coronavirus is not so much, it's going to be just any type of surfactant. We're all looking for Lysol, we're all looking for alcohol, we're all looking for things. But understand, if you just wipe the object with any kind of surfactant, soap or Windex or any of the things that you can still find on the shelves, you are basically wiping the virus off, and so no longer can get to the portal of entry. Next slide.
Okay, and it's types of PPE. And so do you want me to just kind of go around and then you can like talk on each section?
Sure.
Okay, so we have eye and face protection, safety goggles, safety glasses, face shields, and visors.
Exactly. Common sense, straightforward. Again, we're recommending that if you're using goggles, it has to have a goggle that can't allow a spray. Because if I was to, let's say, sneeze on you and or cough on you, I want to avoid that from getting inside the goggle. So therefore, some goggles have vent holes, others have safety vent holes, which means fluids can't or sprays cannot get in. That's why we just kind of go with the face shield. It's a lot easier, and we're putting those things out. Next slide.
Okay, then there's hand, feet, and body protection. High visibility jackets, overalls and laboratory coats, gloves, hard hats, sleeve protectors, anti-static, steel-capped footwear.
Yep. So again, on this thing here, again, we're talking about a cold virus. A coronavirus is basically a cold virus. So when you're dealing with that kind of virus, we're not having to worry about skin exposures. We're just having to worry about touch exposures. So that's why they recommend gowns or isolation gowns. If you had an isolation gown that was like tissue or very thin, it's not a problem to just keep the spray of a sneeze off of you. And at the end of the day, or at the end of the patient, whatever, roll that up and throw it away. Where if we're talking about a bloodborne pathogen like Ebola or other types of body fluids, then we're worried about penetration onto your skin. But since this is not a skin transmitter, any kind of light outer covering just to keep that off would be fine. As a matter of fact, in my day, as a medical lab tech and communicable disease specialist, we would just use lab coats. At the end of the day, we throw them in the laundry, in the hospital laundry, and we get a brand new one in the morning. So again, with coronavirus, it's not so much formite as much as it is direct contact with somebody sneezing or coughing in this type of environment. There is some evidence to suggest that it can float in the air, but again, that is very circumstantial. It's not like tuberculosis where the bug can float in the air, or in the case of anthrax where it can float in the air, via airborne aerosol spread. This is more of an aerosol spray, more of a, as we used to say, droplet nuclei. Although there is some evidence, so that's why we're still recommending using an N95 to rule that out. Next slide. Is anybody there?
Oh, sorry. So then there's respiratory protective equipment. There's airline fed respirators, full face mask, half face mask, disposable respirators, powered respirators, self-contained breathing apparatuses.
Okay, and again, we're talking about level of protection. If we're talking about, let's say, an N95 mask, that provides adequate protection for dealing with coronavirus. And back in 2002, when we had another type of coronavirus called SARS, at that point there, we didn't know if an N95 would work, so the Department of Health bought a whole bunch of PAPRs, powered air purifying respirators, which are a HEPA filter, and again, that's a more filtration. So if you're using an N95, you're having a protection factor of approximately 10. If you're using a PAPR, a powered air purifying respirator, your protection factor now goes up to 25 with a head cover. If you're using a hood and a PAPR, it runs up to 1,000. And the only thing greater than that is if you have a self-contained breathing apparatus like the firefighters wear, which has a protection factor of 10,000. And that's just astronomically overkill for dealing with a cold virus. So understand the type of protection you have. And again, if we're talking N95, we're talking properly fit tested. But even if you don't have a fit tested N95, you're still going to have more protection than if you had nothing at all. The one thing, if we got into the slide about the difference between an N95 and a surgical mask?
Nope, not yet.
Okay, we'll continue to go on.
And then these are the types of respirators. So I think it's the slide you're talking about. So N95, half face mask, full face mask, PAPR with head cover, PAPR with hood, and FBBA.
And you can just see that, and that just basically reinforces that what protection factors you get. For coronavirus, I'd be more than comfortable having a properly fitted N95, and that will protect me from being exposed. Next slide.
A typical disposable filter cartridge for a respirator. It has when you inhale, air flows through the inlet on the left through a particulate filter, an activated charcoal filter, through another particulate filter.
Oh, okay, yep.
And then
That's
through the
slide
outlet
showing
on the
canister
right of the
filter.
map.
Yep, a canister filter, again, when you have canister filters, the hospitals have filters that also have activated charcoal as well as a HEPA filter in them. And what that does, activated charcoal actually absorbs organic chemicals. And that's why they use it in fish tanks to get the urea and things out of the water. But it also works quite nicely for chemical attacks, such as nerve agents or any of the carbon-based chemicals. And so therefore activated charcoal is able to just impregnate some floss with that, and as the air comes through, just the activated charcoal takes it right up. Next slide.
Okay, this is the one about surgical mask versus respirators. So it says protects patient from you for the surgical mask, not considered respiratory protection, regulated by the FDA. And then the N95 protects you from patients, must be a fit tested, regulated by NIOSH.
Right, NIOSH is the regulatory agency, and they test them, to make sure that they're doing their job. So if I am, let's say, a healthcare worker, and I've got somebody in the back of my ambulance coughing up a storm because they're in respiratory distress, or I'm intubating them, and I've got an ambu bag, and they're expelling particles in the air, I need to protect myself, so I'm going to need an N95. However, the surgical mask named for the surgeon was basically to keep, if the surgeon was breathing out, you didn't want to put bugs in the patient who's got, you know, laid open on the operating table. So they would just put any kind of a light cloth across, and that would keep all of the bugs inside the mask. So understand that a surgical mask protects the patient from you, and a N95 protects you from the patient. So when you see everybody running around with surgical masks in, let's say, the supermarket, what that does is collectively isolates everybody there. So if they've got, let's say, COVID-19, they're not going to be able to pass it to the next person next to them. So that's more of a way that we all protect each other if we're all wearing a mask. That's lightweight. But if somebody were to sneeze and you had a surgical mask on, it will come through there. It'll cut the number of bugs down, and that may be helpful, but it does not protect you. So if you want to, as you're working as a healthcare worker, and that would be police, fire, ambulance, or emergency responders, you want to wear an N95. And that's why the Department of Health has been issuing out N95s to police, fire, and ambulance, so that you folks have out in the field, who are the tip of the spear sometimes, that you have adequate protection against people who you may be trying to help and get to the hospital. Next slide.
Particulate respirators, face mask terms. There's the N95 filter media disposal mask. When they're properly fit, tested, and worn, will provide protection up to 95% efficiency for 0.3 micron particulates in dry and non-oil aerosol exposure.
Okay, this is the slide that shows you the different terminology they use for N95. N100 would be HEPA filter, and that would be 100% of the 0.3 micron particles, and that would include viruses and bacteria and things like that. And some people have said, well, viruses can be smaller than that. Can they pass through? And the answer is no, they cannot get through all that media. And so that's why they provide adequate protection. Plus, generally, a virus is not going to be by itself out there. It's going to have some other moisture or other things that make it bigger when it's floating around. So that's why N95 is named called an N95. If it's a P95, that means it gives you some protection against oil. Or an R95 would be a resistance to oil. And they say, well, why would I need oil protection? And if you were a postal worker and you're working with a machine that does canceling, it puts out micro drops of oil in the air, and then so they would need a P or an R rating on their mask, where we're healthcare professionals and our patients don't exude oil. We just need an N95. Next slide.
Helping you wear it right, and it shows how to wear the application of
how to duck. Yep,
help.
Exactly.
Yep.
That's a good slide. And again, I hope that you can download some of these slides. That'd be wonderful, because later on go back. Again, there's plenty of instructions out there how to put on a slide at N95 and how to take it off. The most important thing that they told me is when you go to pinch the little metal piece on the nose, make sure you don't use your thumb and your finger, that you use both fingers to provide equal downforce on that little piece of metal there. And the reason for that is so that you don't have one side open up a little bit more than the other side. It gives you a better seal. So if you follow the instructions, the mask will be your friend. But even if you get it wrong, you're still going to have much more protection with the N95 than if you didn't have it. Next slide.
The table of hazmat level protection, and then it works from level A to D.
Right, and this is not really important for this particular application, but it's basically level A is a space suit with your own, usually about a 45 plus minute air tank. That's for dealing with really bad chemicals. Level B is basically a splash guard type suit, like a rain suit, and you still have your own air with the SCBA. And again, firefighters, we're somewhere between probably level C and level B. So as long as you have your own air supply, you're doing well. And firefighters generally, with their turnout gear, are probably good even in chemical environments for about 30 minutes. Depends on the chemical. And level D is just your regular work clothes. But if you're in the hot zone and you're wearing a respirator that's not got its own air supply, like you see there, like a canister filter, that is not recommended. That's more for warm zone or a little bit of off-gassing. So if you're going in the hot zone, you should have your own air supply. Not really too much of a concern here with the coronavirus. So you can just skip probably the next 4 slides, which go more into detail of each one of the type of hazmat levels.
Okay, and then there's the evolution of PPE for Ebola.
That slide there is showing you how the old equipment that we used to have and the new equipment. And the old equipment for Ebola is not really easy to catch. As a matter of fact, I know we also found out that people are more in the early stages of Ebola if they've been infected and they're just starting to show flu-like symptoms. The viral load is very low, and at the same time, most of the viruses are in the lymphatic system. So these people are, even though people were living with these people, they weren't coming up positive as a contact because the virus was still basically in the body. It wasn't being expelled out. As people got much further on where they start to get closer and closer to, where they have bleeding problems and all the other things, at that point, the viral load explodes to, from 1,000 virons per milliliter to billions of virons per milliliter. Now this person is highly infectious. And especially after they died, the people who would clean the bodies would become exposed, and that's how it was going on. So many of the physicians that were dealing with Ebola in Africa were saying, if I can stop the funerals from people cleaning the bodies to show respect in their burial services, I can stop the infection. And that's when they started to just take the bodies as people died and then bring them right straight to the grave without a funeral, which upset many of the local people and their customs. But again, just the nature of the bug. Coronavirus has also got, early on, has a lower viral load, and much later on, a much higher viral load. So there's a lot of information coming out about viral loads and at what point are people most infectious. Now, people can be infectious, but again, we're getting back to that numbers game that we talked about earlier, where if you're putting out a whole bunch of bugs, then it's easier to overcome the body's immune system. There is even some evidence to suggest from a Japanese study that if a person gets a micro exposure, just a teensy-weensy exposure to coronavirus, and they do get infected, they're going to have a much milder case versus somebody who got a good old-fashioned sneeze and breathed in at that point there, and they might have a much more serious case. So there's some evidence to suggest that basically reducing the risk or the numbers of bugs can also reduce the severity of symptoms. Next slide.
Isolating source.
Yep, there's a lot of ways we can isolate the source, and is that the one that shows a person in a little tank?
Yeah.
Container, or yep. And we actually have 3 of those in South Dakota that we have if we have to move a patient that had it, like we bought them for Ebola, but probably not necessary. We have special teams and special ambulance companies that are contracted to provide transport of known people with coronavirus infections. And again, for them, we provide additional PPE. The one thing that we've done is we've expanded beyond that, and we now have, and I wish I could show you, you probably will see it in one of the slides, we actually have a kit now that we've made up, and they're sized from medium all the way up to 4XL. And these kits have in them everything you would need as an EMT if you were dealing with a coronavirus or transporting a person with coronavirus. So you have basically the suit, the booties, the head cover, the face shield, N95 mask, and you also even have a little surgical mask in there that you can put on your patient to reduce their output of coronaviruses. We've just made these up, and we're starting to pass them out through we polled the EMT ambulance companies and say how many you want, and we're recommending that the ambulance company get about 4 of these kits, and they're in like a 2-gallon Ziploc bag, and all the stuff's in there, gloves, booties, the whole 9 yards, and we're recommending about 4 kits per rig, and that way you have your initial, plus you have at least 1 level of backup. So that's the new thing that's coming out, and we'll start to mail those out, or probably shipping them out probably on Tuesday. So if your ambulance company if you're working as an EMT and you want one of these kits, again, Julie from the EMT Association has got the contact information of how to get those in. And we're asking people to size them so that you get something that'll fit you rather than somebody who's 5 foot tall ended up with a 4XL suit, tripping all over it inside of it. Next slide.
The PAPRF in our South Dakota hospitals.
Yep.
And it shows the 2 previous models and then the new model.
Right. The new model is a much better model. It's also got a whole bunch of safety features in it. If your battery starts to go down, it will beep at you and vibrate, and you'll know that your battery's going down. They last about 9 hours of continuous use, and they have multiple filters. There's a HEPA filter, there's chemical filters, and there's other filters that we have even for if we're dealing with ammonia, because that's always a concern in South Dakota. Those are already fielded, and there are about 1,000 of them in the state, and they're all at the hospitals at this time. Next slide.
The PAPR practicum, Donnie and Dawson.
And that would be the part that we would basically have a little class on how to put it on, how to put it off. So at this time, I just want to let you know that we've got a lot of N95s. We have a lot of surgical masks. Our state health department has been hoarding this stuff for about 15 years. Every year we get funding from the federal government to buy stuff, and we have been buying it. So when we started off with coronavirus, we basically had about 1 million N95s and 1.3 million surgical masks available, plus some other PPE. And we've been putting that out to the hospitals, the police, fire, ambulance. Also, we've been putting it out to the nursing homes and their staff, because the residents of nursing homes are very vulnerable to coronavirus. And we still have a lot of stuff left. We don't know how long this is going to go, but at the same time, the nature of coronaviruses is that over time, they seem to wimp out. They seem to be less virulent, and we're hoping that follows suit. We don't know if it will, but I remember when SARS first hit, and about as soon as late spring came about, it just kind of wimped out and went away. We don't know what happened. And the same thing with MERS, which was another coronavirus. So we're hoping that this COVID-19 illness that we're experiencing will become milder and milder over time. We've done a really good job in South Dakota with our, because let's face it, South Dakotans practice social distancing and every day, and we've been doing that since 1889. So we're not seeing the numbers that New York or New Orleans is seeing, and people are being very compliant with that. But at the same time, we're also flattening the curve, and that allows us to be able to provide better treatment, since not everybody's getting infected all at the same time, and so therefore the hospitals can handle the load. I just shipped out we have 61 ventilators that we had bought years ago, and those have all been gone. Those have gone out to the hospitals that have been designated that will be providing the primary treatments for people needing respiratory support from coronavirus. So therefore, those have been shipped out and are at the hospitals today. And we also have more PAPRs going out, the old AirMate system that you saw on the slide. We didn't throw them away when they got deactivated. We kept them, we maintained them, and we're putting about 400 of those back out too into the system. I would just be curious as to the audience, what are they from hospitals, EMTs, police, fire, ambulance? What is my audience?
Primarily, Chuck, you're looking at EMTs and local fire departments. Yep.
All righty, excellent. So you local fire departments have, and I would just say, if there's a way you can poll them, do you feel that you have enough initial PPE to deal with this disease? And if not, then basically go into the call center and request more PPE, and we'll try to support you. I am also a firefighter. I've been a former police officer, and so therefore I know what the job is, and I know what the equipment that you're going to need. So we have been putting out, when we get requests from police, fire, and ambulance for N95s or surgical masks or gloves and some face shields, we supply it, because we want you're tip of the spear. You guys go down and you gals go down, there's nobody to transport me to the hospital if I get it. And I'm 65, so I'm vulnerable. So I want to make sure you folks are ready to go. Any questions from the audience at all?
If you have any questions, go ahead and unmute and go ahead and ask Chuck if you have any. We had one come through here a little bit ago, just trying to talk about the kits that are coming out. You touched on it a little bit.
Right now. Oh, excellent. Good question. I've got 400. There's about 450 kits right now. First come, first serve. And I'm issuing out 4 per rig, and based on the sizes that they want. And again, we talked about just all you're going to get is a big 2 to 2.5 gallon Ziploc container that has all the things you would need for that one event. And so therefore that's a new thing. And that way, in addition to the masks or N95s you already have, this is just something that's very simple to throw in the rig, and it doesn't take up a lot of room because I know how little room there is in ambulances these days. And so that's something we have. We'll be shipping out starting Tuesday. And the one thing I do ask is if you put a request in, the Zippy Delivery is, I should say Speedy Delivery is a company that is basically bringing them there. Make sure you have an address that somebody will be there. You know, most of the times the ambulances, when they're not making runs, there's nobody at the facility or the garage. So when you give an address, even if it has to be your own home, basically give an address where they can actually make a physical delivery. They don't do PO boxes, and they want to make sure somebody's there to receive the package.
Yeah,
Any other questions?
This is Dr. Owens. Can I jump in?
You bet.
Chuck, I'm so very proud of you. You've been training medical students for 15 years, and you just did an entire lecture without telling these people how many cans of Denny Moore stew they need to have ready for the zombie apocalypse. And as all the listeners should realize, that's an achievement, Chuck. That's good.
But and again, it's self-serving because of the fact that when I go down, there's going to be one of those people in the audience that's going to carry my butt to the ER to save my sorry little ass. So I want to make sure that they're ready to go.
I did get a question on the chat portion of this. Is there any way that we can use Lysol wipes to like wipe down an N95? Is there a certain amount of hours that you could do that, or is that something that's not recommended at all?
I've been looking, and people are trying to come up with ways they can extend the life of their N95s. You have to remember, you're dealing with a particle filter, so you're dealing almost like, think of it as layers of tissue paper. If you get it all wet, it can bog up. If you spray it down with Lysol, basically you're going to affect the filtration part of it. The one thing that I've seen one of the hospitals do, and they brought in their physicists, they brought in their radiation people, and they set up a bunch of UV lights. It's almost like you took your N95 and you stuck it in a tanning booth. And you have to remember that viruses and bacteria hate sunlight. They hate it because the UV rays just break up their RNA or DNA depending on what kind of bug we're working with. So if you took your N95 and you wanted to extend it, first of all, you want to make sure that you put your name on it somewhere so that, you know, Bob gets Bob's back and Mary gets hers back. And then basically, if you wanted to extend it, I would say put it in the sun for a week, and it's probably going to be a nice sunny day will just destroy any kind of viruses that are on there. Or if you have a tanning booth nearby, throw them in there and let them sit for about 10, 15 minutes, and they'll probably, basically probably be okay. Some people put them in the microwave, but the problem with that is you have metal. They say microwave for 33 seconds. The problem is if you have metal staples holding on your elastic band, it's going to arc all over the place, and that's not good. So right now, my recommendations is not to wipe them with any kind of chemical or spray them with Lysol, because that will have an effect on the filter media. Does that make sense?
Yes, I think that answered the question. There was another one that came through, just a comment that came through. Keith Sharisky did post the supply request form, and then he also emailed it out. So for those of you that were looking for that supply request form, and I'm assuming that goes right to you, Chuck, right? That supply request form?
I'm the gatekeeper. So we basically, we had these kits in a modified form, and Bob Hardwick and Marty Link basically put them together for their special teams. And we decided, why can't all EMTs be special teams? So therefore, they decided that if we had the suits and all the other parts that would go into these kits, why not put them together? So that's what we're doing. We're taking stuff out of our warehouse. And so in each kit, you're going to get an N95, you're going to get your face shield or goggles, depending which what we have in there. And then you got 2 pairs of nitrile gloves plus the suit. The suits, some are blue, some are white. They're all good for universal protection against bloodborne pathogens, so easily handle this bug. And again, I wouldn't use every run. I'm not going to be using this suit. I would still, at the same time, use N95s that you've been given, as well as I've given you guys surgical masks. so that you, if you can, put it on the patient. So if your patient can handle a surgical mask because they don't have too much respiratory problems, put it on them, and that provides protection from you, so not putting out as many bugs in the rig on the way to the hospital.
All right, Chuck, another question that came in was in regards to fit testing. Is there anything, I know I was on the EMS call last week, the Department of Health EMS call that Marty ran, and he said that there might be there's some possibilities with the Department of Health up here. We have a lot of folks, a lot of services who are not fit tested. Do you have any avenue for folks to get fit tested if they
right now, keep in mind the port account machines, which are the ones that do the fit testing, there's only a handful of them around the state. And so, you know, and that's why I'm saying the ideal situation is fit testing. But there's also studies that have been done to say, what if I'm using an N95 and it's not fit tested? You're still going to get you're going to, you know, and I'm just going to throw some arbitrary numbers out there. Imagine that you were getting 100% protection from a properly fit tested N95. You're still going to be up in the 80 to 85 percentile, even if you're not properly fit tested. And that's what the studies have shown. So for me, I'd be sitting there, I'm willing to take, if somebody told me that I was going to win, I had an 85% of chance of winning the lottery, I'd be putting dollars down. Better than, it's not as good as the golden standard, but it's still very good protection. And the other thing too to think about, yeah, go ahead, Doc.
I did have a comment come through from Cody Bond. Thanks a lot for this comment, Cody. Avera Business Health in Sanford and Aberdeen are both fit testing right now. So there's two avenues in Aberdeen that folks could get fit tested. That is
awesome. If you can find one of the hospitals that's fit testing and try to see if you can piggyback on them, because they'll have the port account machines, and that way it gives you it's much better to be fit tested. But at the same time, I think only a hand select group of hospitals. We ordered more fit testing machines at the Department of Health, but think about it. When you have a worldwide pandemic, everybody in the world is trying to get the same items. We can't even keep toilet paper in stock in this country. So you can imagine something like a port account machine trying to acquire that.
Yeah, another question.
Chuck,
go ahead, Doc.
Dr. Owens, can I jump in?
You bet.
Okay, we've got everybody on our EMS fit tested. We have that equipment here. I will not be volunteering the nurse that does this because I do want to extend my life. She would be more dangerous than COVID if I volunteered her for this, but I will see what I can do.
You're absolutely right, Doc. Yeah, this is going to require a team effort because of the fact we have limited resources. And so therefore, that's wonderful if you can even have a fit test. It's not difficult. I mean, it's just to do a fit testing is not difficult once you're in. So therefore, if you can have somebody demonstrate to somebody and let them borrow the machine for the night, that'd be good too. We've been ordering more of the, it's called Bitrix. It's a bitter powder. And we've been ordering more of that so that we can support the fit testing machines that are out there.
Chuck, I had another question that came through for you. Is only the duck bill type needing to be fit tested, as the clamshell type cannot be fit tested?
Oh, I never heard that. The ducky bill that's put out by Kimberly Clark, I believe, the orange, it looks like a duck bill. When people cannot fit test with any other type, somehow the duck bill always works. So that's why I always say, as a last resort, try the ducky one. It looks weird, but it actually seems to be working better than some of the other ones. The clamshells, which I'm assuming are the 3M 1870 type or the flat fold, those work quite well. We have a lot of hospitals that use those exclusively, as well as and we also have the blue ones, they call them the 3M model 1860, and it also has a small version called the 1860S. Those also have very good fit testing capabilities too. Ducky seems to be the one that you use when nothing else will work. And in some cases too, we've been using, I got a call from a clinic today that said that their lab tech could not, and none of them would work, including the ducky. So we're basically going to send them a little airmate papper to try to resolve that issue. Now, before you jump the gun, I only have so many of those, and so I can't pass out airmate pappers to everybody.
This question here is probably for anybody who does fit testing. What is the fit test procedure? How long does it take per person? Does anybody have an answer for that one?
I know when I was fit tested, it took approximately about 7 minutes once we start the test. And you just literally just put your mask on, and at that point there, they put like a baggie over your head, and then they spray a little bit of this Bistrix, it's called. It's basically a very bitter type powder. That's the right size. And then after that, they basically see if and if you can taste the bitterness, then your mask has a leak. And they also have a way that they have a little probe that they can put in there inside that will also see if it can detect the Bistrix. So if you don't taste any bitterness, then at that point, you know you have a good seal. Plus the port account will also provide I believe, a quantitative measurement of whether or not you have a good seal. About 7 minutes per person.
Hey, yeah, I'm getting a couple answers. I've chimed in about 15. Yeah, 7 to 15 probably.
Wow.
Yeah.
Okay.
Anybody else have any questions for Chuck or Dr. Owens or anybody else? I see we got some chats going along on the chat. That's great. Is there an acceptable solution of bleach to safely disinfect your equipment and vehicles? Anybody have an answer to that one?
I would go to the web, and I've seen everything from some people using very high concentrations of bleach. Coronavirus is not hard to kill. It's very susceptible to bleach. I remember as a lab tech, I used to use a 10% bleach solution for countertops and much less for my hands. I would not recommend bleach because of the fact that it's very corrosive to aluminum and other metals. And also it can really, it's not very friendly to your skin. Soap and water works fine. If I wanted to clean any kind of disinfectant or surfactant would work fine too. If I wanted to clean the doorknobs or handles on my rig, I would just you can use any kind of surfactant, anything soapy. It can be something like Windex. It doesn't matter if it's an acid or a base. The preferred is always Lysol, but good luck trying to find it. So at that point there, if I could find spraying, any kind of surfactant, I would use it. And that could be something, I could just think off the top, Windex would be wipes off bugs. Also you have 409, all the different types of chemicals that we have for cleaning countertops and stuff like that work quite well. You don't have to use bleach.
Yeah, big thanks to Renee Christensen for posting a comment. EPA.gov, www.epa.gov has a list of chemicals, how long they work, and how long it needs to stay on. So thanks a lot, Renee, for that comment. Appreciate that. Anybody else have any questions or comments, concerns?
The official, if you look at the official sites, they're going to say basically a chemical that's tuberculocidal, and that's the ideal standard. But again, what you're just doing here is not sterilizing; you're disinfecting. You're cutting down number of bugs.
Okay. Does anybody else have anything? I did see one earlier as far as you mentioned putting N95s in the sun. Somebody mentioned that if they throw it up on the dash of their vehicle in the sun, will that kill the bugs that might be in there, or at least
we know that UV rays will kill them. How much, how strong, and again, that's the time is the part that I would say go on the web and see what people have tested and found works.
Okay.
I know one fire department that's thrown them in the sun, and again in a room that's very sunny, and they leave them in there for a week. They're taking no chances, But at the same time, I say, well, coronavirus won't last on an N95 more than 3 days anyway. So, if you just time them out, you're probably going to do fine anyway. But at the same time, that makes sense. I mean, that fits the science. I would just be curious on the chat rooms, or if anybody that's not been able to acquire N95s to protect themselves.
Is there anybody that's struggling to get N95s? If you do, go ahead and chime in on the chat. Nobody's typing in right at the moment, but Keith did share that request form. And just a question for you, Chuck, is as far as that request form that comes to you, does that need to be sent by a certain individual, maybe for getting supplies, or if it's somebody from just a volunteer fire department, a volunteer ambulance, a certain chain?
Well, Julie is the one that has basically been collecting the data for that. And then she sends me a list every day that's updated that gives me an address, a point of contact, email address. So if I have to converse with the person, and so I would say continue to go through Julie and just contact her and say, we have this many rigs and we would like these sizes.
Okay.
And I've got a crew coming, I've got a volunteer crew from Department of Transportation that's actually been taking the time and stuffing these, getting all the equipment together and then creating these kits. So right now I'm about, I'd say about 400 kits, and we're going to start shipping out on Tuesday.
Okay, another question that popped in, this could be for anybody. Do the cloth homemade masks do anything to protect me?
Yes and no. They do, but at the same time, what level is we can't determine, because if you're looking for a substitute for an N95, we recommend something that's NIOSH approved. Bob and Mary's quilt shop with a rubber band around it, I don't know if it's been tested for any particular size particles. So I would say that stay with what we have right now. If you're looking for something like a surgical mask, which is something you'll wear about town just so you know, then yeah, anything will work. As a matter of fact, when I go into Wally World, I wear a kerchief. Like I look like kind of an old bandit out of the Old West. And that's all I use. And people say, well, why do you do that? And I said, well, because it works.
Yeah.
Anything that'll an old kerchief is going to work quite nicely to keep me from passing bugs out, and it'll probably filter out a few bugs coming in. And again, I'm just all about trying to cut down the numbers. So I don't wear an N95 in public. But I do have my little bandit kerchief. And I should probably go into the bank sometime, see if it works there too.
Might be looking for a new guy to be handing stuff out.
Yep.
Question for right along those same lines as far as the cloth mask. How about a cloth mask over an N95? Does that protect the life of the N95?
I would have to. I can't answer that question because I've not seen any studies on it. But I'm noticing in New York City that you see that the ER docs have double layer. They put they wear the N95 to get the seal, and then they put a surgical mask over that, so that any bugs that stay on the surgical mask and don't, since the coronavirus is not going to penetrate that, and therefore it protects their N95. That's the theory, but I don't know how effective that is. And if I don't know the answer to the question, I'm not going to say yes or no.
Okay.
But that's what they're doing. But it makes sense, them saying okay. But is it at the same time, does it extend the life? What do they do with it at the end of the day? Don't know.
Yeah. Okay.
It's almost like a little kind of a shield for a shield. You know what I'm saying?
Yeah. Yeah. Do we have any more questions coming through on the Zoom group? Dr. Owens, did you have something?
I was just going to ask Dr. Lazier, we're doing messaging here daily through our local emergency manager. Would it be a reasonable thing to say and a reasonable thing for these EMTs to really push for friends and family that have allergens or allergies is trying to get on the antihistamine, the nasal steroids, and the nasal washes so that we can kind of separate out those folks rather quickly, because if they're not sneezing, coughing, wheezing, they won't become part of that, what we see in the ER. This is more of a public health question.
Yes.
I'm afraid that I can't answer that one.
Big difference. And of course, if you're not having them measured for fever, which is going to be a much better way to screen them out, if they are doing the sneeze and cough and wheeze and that kind of thing, you're going to get them screened as a positive, and then they'll probably go to another part of your hospital. So yes, antihistamine, nasal steroid, leukotriene, if you warn them about the psychological potential, all will make a difference in their allergic presentation.
So the take home to the EMTs here, if you have a predilection to having seasonal allergic rhinitis, maybe start up the antihistamines, et cetera, now, because just looking at the trees, I think we're moving up that chain pretty quick.
We are already in season, and we're definitely in season for mold, which is underneath the snow. So you're going to already have people presenting.
All right. Do we have any other questions for our group of panelists that are on the call this evening? Hearing none, a couple of quick things. Take care of each other, talk to each other, and make sure everybody's getting through this thing. On the mental health side of it, that's a big deal. We're thinking week 3, 4, something like that. Most people don't even know what day it is anymore. But we're getting into the the higher case side of things on in our state. Obviously, you're seeing the kind of the hot spot down in Sioux Falls getting going. So keep aware of that. The one question that I did have for Dr. Owens before we do wrap it up is on the med side med student side of things. I know you mentioned it last week. Do you have any more information as far as med students who could potentially become available to areas that might be harder hit?
I do have some issues. Basically, as we talked last time, we've got the Silver Basin Training Center, and they have some awareness level training. I'm working with the med school on what that's going to look like and what sort of logistics need to happen in order to move forward with that if they so desire. But I will definitely be keeping you folks aware of how that's, because you're going to be part of how that's going to play out.
Okay. I did have another question pop in if Chuck's still on the line. What would be, if we could get maybe an update on supply requests? Everyone obviously is kind of after the same item, and the example that's being used in the question is gowns. What do you have for gowns? Are you able to keep up with that, or are you looking for more of those?
Right now, if we're talking surgical gowns, all the supply I've gotten in from the feds has all been sterile surgical gowns. So that's basically we're reserving that for the hospitals because of the fact that that's a limited supply and that's something later on they're going to need. We don't have any isolation gowns. Everything that I have has already been given out. We don't even have any for our staff, so therefore gowns is something on our hot list, and we're trying to buy more or acquire more. And good luck, that's probably easier to find toilet paper right now than you can isolation gowns. So then the surgical gowns are going to be reserved for the hospitals. There's just no way we can not do that consciously. So gowns is tough. And that's why I think some of the hospitals or even some of the clinics are starting to go back to a kind of like a lab coat type thing that they just wash every day and reissue.
Okay.
So we're just trying to capture, and again, the risk to getting things from a gown is very, very small compared to respiratory inhalation or direct, to the respiratory tract. So gowns is kind of one of those areas where if I didn't have a gown, I would just probably, if I was working at the end of the day, I would probably remove those clothes, bag them up, get another pair of clothes, and then go home or shower before I, give hugs to the kids and that. So.
Okay. All right. Thanks a lot for that.
Don't have them. If I had them, I'd be shipping them out left and right, but it's not as critical as the N95s and the surgical masks and face shields.
Sure. Thank you. Renee did post a YouTube video, a great video by the Emergency Nurses Association that speaks to rapid sequence intubation for those folks who are doing intubations. So if you want to copy that link down, that's in the chat box right now. Go ahead and grab that. Otherwise, do we have anybody else that has anything this evening? I'm probably not going to go back through every speaker, but if we have any of our speakers that want to give some closing remarks, this would be the time to do that.
This is Dr. Owens. I'd really like to thank all the folks that were a part of this group, and a special shout out to the folks from Ohio. You learn something, tell us. We learn something, we tell you. That's how we'll get her done.
Yeah, that's very much appreciated to get some different views from different states. One other comment that came up, and it was something that I had on my list, but I forgot to put it up. Renee, again, there was a recommendation that came out, I believe it was this morning, from the American Heart Association for some COVID patient CPR updates. So if you want to log on to the American Heart Association website, there's going to be some updates and some recommendations on how to do CPR safely and effectively on a person who has COVID, and also keeping yourself safe. So thanks a lot for Renee for reminding me on that. I appreciate that. Anybody else have anything this evening? Do you guys want to keep having these weekly? If that's the case, go ahead and go in the chat and give us your responses there. I'm seeing yeses all around. So I think we'll continue to meet weekly just to get some information out. We'll probably bring some different speakers in to give updates. We might not last the full 2 hours, but we will try to get updates out as best as we can on a weekly basis. So be looking for an email, again, probably Tuesday or Wednesday with the link on it. I know there were some issues this past week with the email that I sent the link out to. Some people did not get the link or the login or the password. So hopefully we have those rectified, and we will. You'll probably see an email from me either Tuesday or Wednesday to talk about what we got going next week. So with that, do we have anybody else that wants to speak on any topic related to COVID-19? All right, with that, we will go ahead and adjourn for the evening. Again, those of you who need to get hours put in for your South Dakota EMT certification, if you did not get those put in, please email or text me your name as it appears on your EMR or EMT card, and I will make sure and get you put in if you're not in already. If I could get those probably within the next hour, that would be great, so we could get those logged. So with that, if there's nothing else, we're going to go ahead and sign off for the evening. When I send the email out for next week's webinar, we will have the link again for this week's webinar and last week's. So you can go on and review those if you'd like. I know Chuck had some good slides in his that might be beneficial for your departments on putting on an N95 and so on. So if you want to go ahead and view that, it will be available probably on the AHEC Google Drive page on Monday or Tuesday. So with that, Michaela, do you have anything to add?
Nope, I think we're good over here.
Sandra, are you on? Sandra Durek, do you have anything to add at all?
Yes, we really appreciate everybody participating, and a special shout out to Michaela for all the organizing that she did.
Yes, for sure. We really, really appreciate it.
Thank you.
I know we hit 80 participants, and I know AHEC did open up the Zoom a little bit further so we can get up over 100. So if you have other people in your group that wants to be a part of it, we do have room. So that's great. Okay, so with that, I think we will go ahead and end it for tonight. I am putting up my phone number on the chat. I did have a question for that. So it's 605-216-6794. Dr. Owens, did you have some closing remarks?
None at this time. Thank you for listening.
All right, thank you. And thanks a lot to all of our participants who took time out of their Friday evening to give us some insight and to help us as we are progressing through this virus. And hope to see you all next week. Stay safe. And if there's anything you need in the meantime, reach out to myself or any one of our district officers. If we can be any of us assistance to any of you, that would be great. Just reach out to us. So thanks a lot. Have a good evening, rest of your evening, and a happy and safe Easter weekend. Good night.